welcome everybody. Before we start, I'd just like to acknowledge that I'm joining you today from the land of the Whadjuk Noongar people, and I'd like to pay my respects to elders past and present. But being a webinar, I know that many of you might be joining from other areas of the state or even country, probably not. But if you are, I also just want to acknowledge the elders from the land that you're joining us from today. Acknowledge them as the traditional custodians and acknowledge that the land was never ceded. So Wednesdays at 1, which you're joining us for today, is what we hope will be an ongoing series of webinars from WACOS about key issues facing the community services sector in WA. So in this first series, we're inviting input and engagement from the broader community services sector about not just recovery, but key issues that have arisen or are key pieces of research like we have today in terms of the 100 Families Project. So each webinar features a presentation from WACOS and our key partners, followed by opportunities for conversation and discussion. So we will be using the breakout room function a little bit later on. So I just encourage you, if you can, I know some people are not in the position to be able to, have your camera on and your microphone working. So in terms of Zoom etiquette, if you can just remain on mute, but if you can keep your video on because it's lovely to see you. We have the presenter view right now, but I really encourage you to use the speaker view a little bit later. So we're going to pull the PowerPoint down after the first few slides, and I just encourage you to use the speaker view so you can see the person who's speaking at that point. And please just do be ready to participate in the small group conversation, because I think that's where we get quite a lot out of it. So for this session on the impact of COVID-19 on families in hardship, we're joined by Alex Hughes, who's the manager for 100 Families, Nikki People, sorry, Nikki, I hope I got your last name right, from Mercy Care, Jennifer Snell from Uniting WA, and Sally Green from Centre Care. So Alex is going to make some overall comments, and then Nikki, Jennifer, and Sally will share some reflections from their services perspective. And we absolutely will make the slides available. That's usually the first question that I get. And I also just encourage you all, we've had some really good chats happening in the chat box on the side. So if you've got a comment or questions while the presenters are speaking, feel free to pop your question or your comment into the chat. And often we have a bit of a lively conversation going there at the same time. So I'm going to hand over to Alex in the first instance. So Alex, take it away.
Thanks, Kylie, and hi everybody, and thanks for the opportunity for us to speak today. I'm only going to speak for a few minutes and give you a really quick overview of 100 Families and some of the recent findings that we've collected. So if you haven't heard of 100 Families before, we're an action research project. So the purpose of that means action in terms of once we've learned, we do. So we've done almost 2 years of data collection, and that's really engaging families, actually 400 families, even though the name's 100 families, 400 families, understanding and learning about their experiences over many different areas of their lives. And we're just about to engage in the doings, and now looking to see what we can create action towards impact from. There's 2 ways we collect information. One is a survey, so that's every year. So we started collecting data in December 2018, and we've just finished the Wave 2 survey, so the second survey. And the other way we collect information is through interviews, so engaging 100 families, so that's the 100 Families part, every 2 weeks for a whole year, and that just ended a couple of weeks. That's huge, really, really in-depth look at people's lives. Now this is a different part of the project, because obviously no one knew that coronavirus was going to happen. So this is a supplementary survey of 158 people. And some of the things that we're going to talk about today is really mostly based on that. So people's experience of COVID-19. So with that, I'll get into the first slide. Just click. Right, so again, like I said, this is a really quick snapshot. So for more information, more detail, please do go to our website, and there's a lot more detail on some of the findings you're going to see. So the first one I'll talk about is finances. So 50% of the families during this time experienced financial stress. Now, around half of the families were receiving the coronavirus supplement. So even though that was still the case, they were still around half were still experiencing stress, and that's almost double what the Australian general public are experiencing. When it comes to education and the schools getting closed during the different social policy changes, it wasn't too bad. So around 3/4 of families found it okay in terms of being able to meet the needs of their children in terms of education, but around 1/4 didn't have the resources to make to help meet their children's needs, and largely that's in relation to things like internet devices, and also just the resources and knowledge of what to do. And that ties into earlier findings we found. 1 in 10 of our families don't have a phone, and around 1/3 don't have the internet. So 26% is pretty on par with what we would have expected. It's a little bit less perhaps, but I think largely because some of those coronavirus supplements were used to buy a computer or to get internet in the home. So that's where that number comes from. And the last one, in terms of mental health, so 38% depressed or anxious most of the time, or that previous week. And if we include some of the time, that goes up to above 50%. So it's a really high number. And it was, you know, a stressful time for everybody, but especially for people who are more vulnerable. Now, this is a bit of a busy slide, so just stay with me. Like I said, about half of the group, 158, so about 79 family members received a supplement. And this describes how it impacted their life. So around 43% used it to pay bills. I don't know if anyone's going to hear it, but there's a bit of a rustling of microphones. I don't know if anyone's got a microphone on they could switch off.
Yeah, I can hear. If everyone can just make sure they're muted, that would be awesome. Thank you.
Thank you. That's great. So yeah, 43% used it to pay utility bills, which is a huge, huge help. In terms of how it impacted their life overall, almost 52%, we can say 52%, said it improved their life. Now, when we think of entrenched disadvantage, of which poverty, financial poverty is one aspect, that's a huge impact, but it's not the whole picture. Obviously, financial vulnerability is only one part of that picture, but a really important one that lets them people start to consider other things in their life that, you know, they'd like to improve. So 52% improvement in terms of quality of life. 28% said they could purchase the food that they needed, and not just in terms of the amount, but also the quality. They started to eat better, not skipping meals and eating more nutritious food. And when we look at, say, like increased stress, I won't read this out because it's very long, but when you get it, perhaps read it yourself. But it talks about it being taken away. The stress is largely around the anxiety of, yeah, it's great to get the extra money, but what happens when it's taken away? So the supplement was excellent overall, but yeah, there's still fear that, you know, what's going to happen when it's gone. Now, a quick talk about the access to services. These are the different types of services that families would access. Roughly speaking, you can see the percentages for yourself. The darker color is if yes, it stopped them being able to access that service. And roughly speaking, it's about half if you look across the board on average. So if we look at food, it's bang on half. Some families didn't need to access that service as much as they used to because of the supplement. And some of the services had to get more creative in terms of being able to allow families to access, you know, for example, food. They weren't able to come in and choose and select the food that they would like, but have a package handed over to them. But half of the families couldn't access those services that they used to, whether it be health services, employment services, or the like. Okay, and the last slide, this is a really big catch-all statement, but in terms of the change to the service access, how did families perceive the difference in terms of positive or negative? Again, it's roughly split 50-50 or 45-55. 45 being to the positive, so it was positive, and the other half roughly being negative. Now, this is really based on the experience of the family. I mean, a lot of the services, and this is something we'll probably talk about in a minute, had to change to things like digital connection. So for some families that worked really well. If they had the computer, had the connection, and had kids at home, it was more convenient to do that. Whereas for those families who didn't have access to the digital world, it meant no access. So it's a real two sides of the coin experience. And in the next release of findings, probably in November, we'll talk more detail in terms of the qualitative about the experiences of families around those changes to service. Okay, I think that's probably it from me, Kylie, if we want to hand over to the main presenters.
Thanks, Alex. I will. So do you mind pulling your screen down, and I'll just walk people through how to use the presenter view. So at the moment, everyone, you are probably in gallery view. If in the top right-hand corner of the speaker, in the top right-hand corner of the black box, there's something called speaker view. If you click on that, it will just make sure that the person speaking kind of comes up a bit bigger. So I will hand over now to Nikki, I believe.
Cool, thanks Kylie. Thank you, Alex. I'm going to keep it in gallery view because I don't really want to talk to myself, but it's nice to see everyone's faces. So I think, yeah, just hearing all the stats and that, a lot of that resonates with some of our mixed experiences across Mercy Care. So my role is the Youth and Homelessness Manager at Mercy Care, and we have a range of services which include accommodation, youth services, family supports, and we've recently implemented a youth mental health outreach service in amongst COVID. So it's been really interesting, I guess the impact that COVID has had on service users, but also service delivery staff, access to PPE, essentials and all of that. So I have a few points here that the team and I just pulled together and thought would be useful sharing. So our experience, we definitely picked up on the 100 families research where it shows that 38% of people felt depressed or anxious, most to all of the previous week, compared to 17% in the Australian general sample. So for us, we definitely notice an increase in demand in terms of new referrals coming through to our triage officer, but also with current service users and extended family members. We definitely worked in collaboration with the rest of the sector, and it was an unusual period where we were, every day finding out new information about what was available, what wasn't, who had capacity to be able to switch to, tele and digital platforms, and really kind of as a wider organisation look internally to, leverage off different departments that weren't considered essential services. So I think for us, it took us a couple of weeks and it felt a bit, I guess clumsy at the time, trying to quickly build networks with our COVID response team and, really ensure that we could minimise impact to a lot of our service users, especially those in accommodation. So with that, we noticed that there was an increase in isolation, a lot more incidents of alcohol and drug use, an increase in family domestic violence, which, we, in collaboration with the rest of the sector, agreed that, this was something that we were all kind of experiencing. And an increase in emergency relief as well. And that hasn't always been our primary, I guess, service option, but knowing, that we had the ethical responsibility and duty of care to really kind of adapt and think about, what was the need of these young people and the families that were coming through. You're not going to be delivering therapy and counselling if there's, basic needs and psychosocial issues and that need to be addressed. But with that, it was also, switching to tele and digi platforms with staff, but also ensuring that staff felt confident and supported with going out into community and working a little bit outside of their scope at times. But I must say, looking back, like you can definitely see the strong values and the passion and the commitment in that. So at a really difficult time, I felt like it brought the team closer together. Basic items such as protective gear, groceries, particularly supporting those who were immune compromised and with a large number of children, unable to access support to meet basic needs. That's where we had to kind of be quite creative and innovative and have a look at what relationships we had through other parts of the business, like aged care and maintenance, and just people were popping up from left field with, you know, different connections and that to increase our resources in supporting people. Some of our young people in shared accommodation experienced increased stress as well, which Alex spoke about, particularly with restrictions and with the visitors. So that's where we were lucky to be able to utilise brokerage funds and purchase iPads and credit and phone credit and data to really kind of help increase, you know, supports with family and friends. We also found that in some of our services where it had been difficult engaging parents and families, there was a sudden increase with a lot of families really wanting to kind of, I guess, bring more supports into the mix with, you know, schools closing down and needing to support, you know, teens at home and things like that. So even now, it's actually been a positive that we've been able to work a bit more. You know, it's been family inclusive practice, and there was an opportunity to strengthen those connections. Just a few more things here. Obviously, the switching to technology, virtual telesupport wasn't the best option for everyone. There were issues that we really kind of had to troubleshoot with privacy, the little credit, poor internet connections, and, you know, some of our service users with really high anxiety or not yet familiar with their caseworkers, not wanting to have that option. So there were periods where there was little contact from service users, and we had to try and find other ways to re-engage. Some positives: we had less cancelled appointments with well-known young people who were bright and ready in the morning at 9 o'clock. So some of our cancellations, the attendance rate went up. And I think for them, we haven't thrown the baby out with the bathwater. We've been able to leverage off that and, you know, mix up the face-to-face appointments as well, you know, with some of the tele or video conferencing. It's actually worked quite well for some young people where transport could be a barrier. Zoom fatigue. Everyone talks about Zoom fatigue for staff, and, you know,
Has Nikki
hygiene around that. Young people not going to work in our experience. So just being a lot more flexible and realistic about what you can actually achieve in those sessions, and quickly having to kind of negotiate what's going to be best for that young person at that time, not what's best for the clinician or caseworker. Yeah, I've got a lot more there, but I feel like I'm kind of coming up to my time. Oh, one last comment I'll make is being Māori myself from New Zealand, I definitely noticed like a huge impact with, I guess, cultural connection and physical affection and isolation, especially with other ethnic groups, and I guess any family where there is a big, I guess, extended family and community, and a lot of that face-to-face connection, whether it's going to church or sports clubs or whatever it might be, like that's huge for a lot of people. So I think there was a lot of loneliness as well, but shame around acknowledging that that had popped up. So we worked with some families around just finding different ways to reconnect and recreate some kind of family traditions, whether it was, you know, learning how to use new technology and, you know, phone and all of those sorts of things. So But yeah, really, really important.
That's
For
great.
me.
Thanks, Nikki. And I think that last point you made is a really important one, in the sense, like, I think the social distancing and the change in the way people lived really affects all of us, you know, not just those who might be experiencing some vulnerability or disadvantage, right? It's important to remember that. So thank you for that. So I should have asked beforehand, did anyone have any questions for Alex or for Nikki before I hand over to Jennifer? It's hard to see hands because everyone's got their cameras off, but you can feel free to take yourself off mute and just ask a question if you have one. No? Okay, in which case I'll just hand over to you, Jennifer.
Thanks, Kylie. So I'm from Uniting WA, and one of the stats that really kind of leapt out at me was the 49% of families were financially stressed in terms of paying for essentials and that kind of thing, as compared to the 26% in the Australian general population. And that's kind of, we provide financial counselling, financial wellbeing and emergency relief services in the metro area. We're part of the Financial Counsellors Network. And so we saw that, but so in the beginning there was exactly that, and there was the panic and that kind of thing, and then the difficulties with us being able to provide the appointments the way that we conventionally do provide the appointments. Like so many organisations, businesses, whatever, we were busily listening to what the health department was recommending, trying to protect our teams, but also at the same time trying to provide services. So then we dropped into a financial counselling via phone or Zoom kind of thing, like so many other organisations did, and that worked out really well. What we saw was fewer lost appointments because it was so much easier for people. So a learning for us is that maybe we don't have to make people come in and see us face to face and bring everything in. We had to get quite good, and so did the people that needed our support, have to get quite good at passing the information between us. So we needed to have, their bank contacts and all of their loan information, whatever they had that they were seeking help with. We needed that paperwork. That's part of the financial counselling thing. And so we had to find a way to be able to do that efficiently, get it quite easily, particularly given that, again, not everybody is lucky enough to have internet access all the time and that kind of thing. So we had to find a way to make that happen. Once we did that, financial counselling became quite easy to do over the phone and via Zoom. And again, less lost appointments. But then as the additional payments kicked in, a whole group of people that we would ordinarily see kind of dropped away. So we quite often will see people who have their own business and get into trouble, and through no fault of their own, but get into trouble, can't keep going with things, or they have a problem through health with their mortgage. And so that group of people remained, but the people that we would ordinarily see quite frequently for emergency relief, which would be the payment of bills and that kind of thing, that dropped away. And that dropped away, and I think the research that 100 Families has shown is because people actually they had the money and they were able to pay their bills. And so that's an interesting thing, because then I wonder, well, is it better to give people the additional money so they can pay their bills, or is it better for the government to finance financial counsellors? I don't know, but it seems to me that it was just an interesting observation. The other area that we work in heavily is street present homelessness. And the stat of 30% of families report a reduction in housing support, that's absolutely, I think, what happened in the secondary area of homelessness support, but it didn't happen in the primary area, that street present, because we actually couldn't close. So even though we were concerned for our teams that were running services like we have Tramby, we have outreach that goes out into the street and meets people early morning or late in the evening, we couldn't stop that because there was nowhere else for that group of people to go. There was no one else for them to contact. And what we observed was, because we became the primary kind of place of contact at Tranby, it was very full on because we had many more people than we usually see. And we had to learn to manage that and try and keep social distancing and all of that stuff. So that was a massive educational process for us, but also for the people that we work with around, because as Nikki said, I think when you feel isolated, that's when you want to have human contact even more. And so my observation of many in the homelessness sector, many of those people are really demonstrative. They hug and all of that kind of thing. And we were crazy running around in the car park saying, please don't do that. You've got to try not to do that, guys, because, you know, this is a really dangerous virus. So it was really hard to get that aspect across to that group of people. I think the other thing that I picked up that was really shocking for me was the absolute fear. Because homeless people who live on the street only have really each other to depend on, and then services like us, but the thought that we might close was terrifying for them because they had nowhere else to go to get food, nowhere else to go to get any kind of emergency thing that they needed, shower, whatever. But also that real sense of abandonment, you know, whilst none of us were delighted with being locked into our homes and that kind of thing for a lengthy period of time. And, you know, I'm sure many of us also suffered with depression and anxiety as a result. However, at least we had a home to go to, and street present people just simply don't. And so their real fear was of being totally abandoned. So that became really important for us to demonstrate that we weren't going to do that, and we were going to keep advocating, trying to find solutions, which I think we have done. The government's worked really well. Most of the homelessness services have worked well together, and we had Hotels with Heart. We've worked with a local hostel to us to get homeless people into there. So many different groups came together, I think, to try and provide some sense of stability for them. But I think that the fact remains that we've been very lucky. We had a very minor kind of lockdown. It's given us all a good opportunity to play a little bit of catch up. But those same groups that were so badly affected before, like street present homeless people, will really be badly affected again if a second lockdown comes, and we haven't learnt to do things better. So that's where I think the research that we're getting from 100 families is really great, in that, you know, it gives us an opportunity to find out what the issues have been through this time and what we need to do differently if there's another time. Have I used up my time?
If you're happy to leave it there, I think that's almost there, Jennifer.
Yeah.
Awesome.
Yeah, thank you.
And I think that's, the points you make in terms of thinking about, you know, the impact of a second wave or a second lockdown. Important ones, I think, for us to all be considering, particularly at this time. So thank you so much, Jennifer. Does anyone have any questions for Jennifer? No, it's a quiet group, this one, very quiet. Okay, I will now hand over to Sally from Centre Care.
Thanks, Kylie. So I'm a program manager in the Gosnells office at Centre Care and oversee the housing and homelessness programs, as well as Beyond Youth Justice and a program called Settle In, which works with humanitarian people entering the country up to the first 5 years. So quite a diverse group of programs, and really with what Nikki and Jennifer have covered already, much of what they've already said, we've experienced with families. But one thing I thought, before I get into the 100 families, the points that sort of jumped out at me, when COVID hit, I was actually overseas, so it was quite early on, so we got back into the country. We were pretty much a last flight out of Vietnam. So I had to self-isolate for 2 weeks, just as sort of crisis happened, I guess, for the sector, where you all were shutting down and what was going on. So I had to do a lot of the management via Zoom for the 2 weeks at home, but also my partner runs family businesses in hospitality, so we thought they were all going under. So just to put it, and Nikki touched on this as well, the social impact affected us all. So I had to deal with, isolating, keeping businesses afloat, or wondering whether we'd have businesses to keep afloat, while also connecting with teams remotely for the first couple of weeks. And then once I could get back into the office, just settling the staff. And I think that was one of the key focuses, I imagine, for all of the organisations, but key when panic, fear, anxiety, all those things were happening with workers as well as the very vulnerable families that we work with. So, Centrecare's 400 plus people, there's about 60 in the Gosnells office, but all the things that our clients were experiencing, really, workers were experiencing a lot of that, not wanting to come to work, taking their kids out of school, vulnerable parents or health issues for themselves or their partners. So that was a real focus for Centrecare initially, and for myself and the teams to really settle and steady the teams. And I think that as an organisation, we did that really well, making sure the communication to the staff was really solid and that they could come and just offload, so that once we had that happening, we could then continue working with the client group, because like Mercy Care and Uniting, we were critical or essential services. So we delivered throughout the whole period. We did go into a short period of time of no contact, but worked very quickly to visit families basically at home at their front verge, or them standing on one side of their doorway and us standing in the front yard or out in their carports, just so that really they could have that physical presence of another person, and that continued contact with workers, especially where there'd been long-term relationships, because they were isolated and weren't having much contact with anyone else. So that was a really interesting time during winter. Workers having fold-up chairs in their boots of their car, setting up in carports, and obviously keeping themselves safe and educating clients about what was going on. Because the other thing that became very prevalent was that a lot of clients didn't really understand what was going on, and especially if you have clients with English isn't their first language, or they're hearing the snippets on the TV, things changed quite quickly and the information changed quite quickly for all of us, and all of us trying to get our heads around it. But so, we've got clients that are still not sure whether they want to leave the home. Is it safe? So just helping them understand what the media was saying, and how they could keep themselves safe, but how they could also venture out and be in the community when we're allowed to be, and be safe. So a lot of the aspects that Nikki and Jennifer touched on, we definitely felt in the programs we ran. But I thought I'd touch a little bit on the education section, because we have a beautiful program that works with families and children. So there was a huge impact on children obviously not being at school, and Nikki's touched on this already, and the families just not being equipped with internet or technology, or having large families, overcrowded houses, and then trying to educate, or actually not even bothering, like, which is completely understandable, because it was just something that they just couldn't bring in and manage, with all the complexities, the trauma. Some of the homes we visit, unfortunately, aren't really that safe. Like in operating now, we would normally, or at times we would visit children at school because it's a safer environment to actually have some, do some quality therapeutic work with them, and we just can't do that in the family home. So keeping eyes on families was key for us. So I would say in the programs we run, the number of, in relation to needing educational support, it would be quite a lot higher than the 100 family statistics. But Alex and I touched on this the other day, some of the cohorts that we work with, and I know that Jennifer has talked about, it was hard for 100 families to have contact with that group of people, because they're so transient or just a little bit more difficult to engage with. The other big one we found was employment. So we run programs as well that support people to link into the private rental market, but there's still families experiencing hardship and needing quite a lot of support. And it was a lot of those families that, find jobs in daycare centres, hospitality, that a lot of the areas where those jobs just stopped when COVID hit. So we have families now really worried about, being able to pay their rents because they've moved into the private rental market. They're not in Department of Housing. And I know there are some things in place, not being able to evict anyone and getting the extra supplements, but what happens when all that stops? And I think it was on the radio this morning about what the availability of rentals is 1.2% at the minute, which is very, very low. So I feel we're going to see a increase in the housing sector, homelessness sector, affecting lots of different people in different ways. And I know when I spoke to Alex about presenting today, he's saying, just keep it to 2 points, keep it to 2 points. And it was like, it's really hard to keep it to 2 points because, the families are so diverse, all our workers and colleagues are so diverse, and we're just impacted, people are impacted by this in such specific and individual ways on one level, that it's really hard to make, narrow it down or keep it specific to the points. And yet the 100 families data is amazing and gives us a, data to work and use, but there's so much going on out in the community services sector at this time for people. So it's probably generally what I wanted to cover. I think the other aspect was for clients who, we had clients who were tested for COVID-19. So you had that worry and anxiety, not just for them and their families, but also for the workers' contact, even though we were doing everything that we possibly could to keep everybody safe. So I think that element is less and less, thankfully, because of where we live and no community transmissions. But that was certainly that had an impact on staff, and obviously with the client group, we didn't have any negative outcomes. But yeah, we certainly had a lot of clients tested for COVID-19, which then, you know, obviously they have to isolate for 2 weeks, and it limits and impacts our interaction and support of them. We probably found in the housing sector initially a decrease in people accessing services. So I think that probably fits in with what Jennifer was sharing around the extra money and people resourcing themselves, which is in the data as well. And we're just starting to see that pick up now, like, yeah, people starting to reconnect back into services, and services starting to get really busy again. So it'll be interesting to see what that all means and how that looks.
Alrighty, what I might do is pop us into the breakout room conversation. I'm just popping into the chat now, a Google Doc. And so if those of you are hanging around, if you can open that, we've got a question, and Alex, I don't know if you can pop your slide back up just so we can see the question. It is also in the Google Doc, but we're asking, given the experiences reported by families, a review of how community services operate in the future is needed so we can provide support in the most suitable and convenient ways. So the question's there: how can services build on what has already been done to help meet the ongoing needs of families? And I suppose particularly in the light of what we've heard about the snapshot of the 100 families research, but also the reflections and experiences of the people from the different service organisations that have spoken today, and also from your own service organisational experience as well.
Extra funding, but apart from that, we didn't, we had to be flexible with what we already had.
Yeah, that would have been harder from your aspects, no, because it would have started you still managing over the difficulties of themselves not to be able to face the work with families or their own issues with their own families and not having enough funding. So the question would be now how these results will be pushing to government policy to get more money into the sector.
Yeah, it's a very good question, Fabiola. So I didn't say this at the very beginning, but there's 10 organisations involved with the project, being WACOS, so the WA Connection of Social Service. So they take these findings and they use them within their own advocacy efforts. So these kind of side actions are happening. But the project is actually meeting in a couple of weeks to now form the basis of our action plan going forward. That will be across different dimensions, whether it be, and it will be, advocacy to government in terms of our calls to action based on our findings. But it will also be change in the sector, and these are all interlinked, like policy and practice, you can't separate them. In the sector. And we'd like to also look as well at community perception. So, you know, just general members of the public. This is something that was picked up on during COVID, how those newly impacted and newly entering into poverty, how, you know, it created a wave of empathy, and the media was certainly starting to report on it in a different way than previously they had. There was less stigma of those who had been in that position for a long time. So we really want to capitalize on this as well. Yeah. There's going to be different ways that we apply our action, but at this point I can't say what they are, but yeah, watch this.
Okay, that's good. Good to hear that. Thank you.
I can say, look, we did get a little extra, well, we got extra funding to do particular projects, and that was around finding accommodation for street present people, because we didn't, in the early stages of COVID, we didn't know that we weren't going to end up with community spread. So there was a real push to get people off the street. So we were involved in Hotels with Heart, and the government gave pledged a percentage of money for support work to go on with the people that went into the hotels. And we've also received additional funding from Lottery West because we've set up a homeless accommodation program in one of the big hostels in the city. So it's kind of a double banger of keeping the hostel going. We negotiated a cheaper price. So it keeps the hostel going, but at the same time, we're able to give beds to people who would ordinarily be on the street. So we did get some funding in those ways.
Yeah, well, that's good to hear that. Thank you, Jen.
Anna, did you have any questions or anything, or no?
No, I just wanted to thank the speakers. That was the presentations were really interesting, and I'll disclose that I'm actually not from WA. I'm from the other side of the country. I'm actually from the ACT, and I've just started working there in community services on thinking about our community recovery process. So I'm just doing a little bit of research around what have been the experiences in some of the other jurisdictions. I saw the webinar and I thought it'd be really interesting because we've also here got quite a specific stream in community services, which is looking at particularly vulnerable families, and I guess some of the modelling around specific cohorts and how they might be impacted in the sort of the longer term. So I was just curious to kind of hear what have been some of the other experiences from other jurisdictions as well, knowing that we're quite different contextually, like because Canberra's, you know, WA is so much more spread out and you've got all the regional areas as well. But yeah, so I just wanted to disclose that, but I found that really interesting, the presentations and some of the things that the speakers mentioned, I think are sort of starting to reflect a little bit in some of the findings that we're coming back. We haven't got a lot of data yet because some of those initiatives that have been put in place are still kind of currently running, so it might be a little while before we get some really solid data, but it'll be good to sort of see if there's some mirroring in some of the kind of experiences as well with some of the groups that we're working with.
Yeah, how interesting, Anna. Welcome. Alex, isn't 100 families, are there other 100 families projects? Like WA is not the only one, right?
No, we're the only one. So there was a New Zealand project carried out a few years ago, which is just based off, but it's a lot larger. It covers, I guess, more areas, and we, you know, have more families involved, and then hopefully will be more impact on the other side. But Anna, one thing I was going to say is you're joining at a good time in terms of in November we release findings all the time. So we have these kind of bulletin. The next one is going to be around. It's going to be the first release of the qualitative findings, and that'll talk about, amongst many things, ways in which we can start engaging with families that will have the most impact. So services are being one, but it's not always about services. I mean, we talk about community and community capacity building and localized ways of agency within communities. So yeah, if you want to subscribe on the website, November, we'll start to release some of those findings, and also around the same time will be the release of our, soon after anyway, our action plan about what are the key things that we've learned, and therefore what are the key themes that we're going to start addressing, and the actions that we take going forward. So yeah, quite in November we'll have a bit more information that might be useful to you. Obviously you need to apply, local context.
Thank you, that's great, that's really good to know, and I think that's one of the things that we're really keen is that whatever response we have, it's data driven, but it's also community driven as well. So we're just looking at how we can capture the information from what's being collected at the moment to kind of have the best response for people.
Yeah, and it has to be, and within our 400 families, I mean, the catch-all is the term entrenched disadvantage, but that is such a broad term that affects people very differently. I mean, when we say family, you could be a single person with your dog, that's your family, or you could be living in a house with 10 other people. You could be a grandparent carer, or you could be a person who's experienced homelessness. So your experience is very different, and therefore the approach needs to be different, but hopefully we can start giving some direction towards how that could be taken. But yeah, that will be soon.
Okay, thank you for that.
Great. Thanks, Alex and Anna and Fabiola, for your questions and reflections. Is there anything else anyone wants to say? No?
No, no, all good.
Well, thank you, Fabiola and Anna, for hanging out right to the end. Thank you, Alex and Nikki and Jennifer and Sally. And sorry, it ended up being quite small at the end. But yeah, I think as you can see, people really appreciated what you had to say and share. So thank you for your time. We'll end it there. So thanks.
Thank you.
Thank you to all the speakers.
Thank you.
Thank
Bye.
you.
Thanks,
Thank
Kylie.
you.
Bye.